Thank you very much, and it's a pleasure for me to be here and to join again the Charité Mayo Congress. And I would like to speak today about the role of the PARP inhibition in the gynecological cancer. And if you see here, we have in gynecology, oncology, a lot of problems and to deal with, and a lot of patients. We have to select the patient because we'd like to improve the therapy and would like to make it personalized and would like to avoid additional adverse effects. And if you look at this slide from the NCCN, you see here it's about 17 different maintenance possibility of maintenance therapy in case of ovarian cancer. And we ask us what wants the patient for us.
Thank you very much for the introduction, dear chairs, dear colleagues. Thank you very much for the opportunity to talk about PARP inhibitors and the use of PARP inhibitors in breast cancer, and above all, the prerequisites for the use of PARP inhibitors in breast cancer. Here are my disclosures. As we heard in all the excellent talks in the last few days here at Charité Mayo, in cancer therapy and the therapy of breast cancer in particular, we always aim at very precise therapeutic approaches tailored to the individual patient. And precision medicine, as we learned in the last few years, has become the standard. We're not talking only about ADCs and CDK4/6 inhibitors, as well as we just heard PI3 kinase, but also, last but not least, about PARP inhibitors as part of our daily clinical routine.